Hi, this is Dr. PJ. Thank you for watching my channel, and we're going to talk about how to protect yourself from getting infected when you go out of your house. Now that the country is opening up again and we're starting to go back to work, out to restaurants, seeing friends and family, and being outdoors in general, we have to know how to protect yourself from getting infected. And I want to discuss the two main principles that you need to think about that you can adapt to most situations once you go out of your house. You have to think about the viral load that you're exposed to and also the exposure time. Thinking about these two things can help you lower your risk and mitigate the chance of being infected. So, I'm going to cover a lot of things, and I might break this video up a little bit, but first we'll talk about viral load. Viral load is the amount of virus that you come in contact with and either inhale or touch with your hands or some other part of your body and get into your body through touching your face, your mouth, your eyes, etc. We know that when people who are infected talk, that droplet and aerosol can come out of their mouth and go anywhere from 3 to 6 feet. Some new studies have shown maybe as much as 10 feet with normal talking. We know that if you cough, yell, or sneeze, it goes even further, and there are studies, specifically Lancet magazine, one that I posted earlier, that shows a sneeze can go up to 27 feet in less than a second. So think about this when you're around people and what the situation is. You also have to think about what kind of airflow there is around your environment. For instance, when I go out and I'm speaking with somebody, if I'm wearing a mask or we're wearing a mask, then that decreases the amount of aerosol and droplets that come out of their mouth down to about maybe 3 feet or so, because it acts as a block for virus coming out of someone's breath. But if someone is not wearing that, then you have to also think about where you are. If you're indoors, if you're outdoors, think about the wind. If you're standing and someone is right here and they might be 6 feet away, if the wind is behind them blowing towards you, you have to be further away because those currents are going to carry a droplet towards you. Or if that's not possible, if the wind is coming this way, step to the side and then go perpendicular to that person. That way, the wind doesn't blow any breath into your face, and the wind will blow it to the side of you when you step aside. In addition, to be courteous and respectful of other people who may be concerned, if the wind is behind you, then try to step to their side so that anything that comes out of your mouth will go away from them instead of right at them. Another thing to consider is if you're sitting outside versus inside in an enclosed space with good ventilation versus poor ventilation. Say, for instance, you're at a restaurant and you have a choice for sitting outdoors or indoors. I would always choose to sit outdoors and away from people. Restaurants are now trying to space their tables apart, but at least outside there's decent airflow and it can dilute the amount of virus that's in the air. If you're inside in an enclosed space, people who are breathing in there have their droplets and aerosols linger, and we've seen studies that show that those droplets and aerosols can be suspended for maybe half an hour or so, but they can also survive in the air for up to 3 hours. And that was in a previous post based on a study by the New England Journal of Medicine published on April 16th. If you have any questions, please go look at that. So when you're inside, even in your house or a friend's house, and you may have strangers there who may be asymptomatic with an infection, you wouldn't know, try to have good ventilation. keep the windows and doors open. If you have a fan, use a fan to try to vent the air and circulate the air to try to decrease the amount of viral load that you're exposed to. The second thing that we want to talk about is exposure time. We've seen studies from overseas that show people who have low risk, medium risk, and high risk exposures. And usually when they look at these studies, the exposure time is probably 10 to 15 minutes. More than that is considered a higher risk exposure if someone is infected and you don't have a mask and they don't have a mask. So if you're inside an enclosed space for a significant period of time and someone around you may be infected, then if you're staying there, you might have an increased exposure time. So the viral load plus exposure time increases your chance of infection. There's a study based out of a case in Hong Kong when there was a family that came from Wuhan right before they shut down and went to Hong Kong into a restaurant, and that was the first documented case in Hong Kong. But in this restaurant there were 5 tables, and I'll show you a picture as well. These 5 tables were lined up 1, 2, 3, and 4, and 5, and the infected person was on this table, and it was shown that this infected person infected their table and the tables next to them. The 2 tables up here were not infected, and people were wondering why, but it was because they figured out the air conditioning vents were here and blew this way. So these tables got infected, but these 2 tables here outside of the airflow zone did not get infected, even though they're about the same distance away with respect to the infected person. So viral load, exposure time is very important, and you got to take all these things that I mentioned into consideration to help decrease your risk. Thanks, and everyone stay safe out there.